Hello, I'm Maria Hall Brown. Well, COVID-19 and the pandemic is still very much a part of our lives, but as time passes, we're learning more. And the most important tool you can have to keep you and your family safe is knowledge and education, which is why I'm delighted to be joined today by Councilman Curren from District 9, as well as Dr. Douglas Harrington from GuardaHeart. There's a really exceptional event that's going to be taking place in District 9. What's going on down there?
Well, we're going to be providing antibody testing for those who are interested and who are concerned. We know how important testing is. We've done it extensively in CD9, and so we're very excited to have Dr. Harrington and his team come to our community to provide this much needed test.
How are things going in District 9? I mean, what's the status? How are people feeling? You know, what are the rates of infection?
I can say that over the past 6 months, we've tested almost 100,000 citizens in CD9, and we've done that very, very aggressively. We've got walk-up testing, we've got drive-through testing. We're working closely with the fire department. They've been testing in our nursing homes and care homes. And so we're excited also to now join that testing with the antibodies that we'll be doing with the GuardaHeart. Information is the most important thing we can provide,
right.
And so it's important that we let people know what's available, make sure it's accessible, and that they're taking advantage of their health, taking care of their health.
So this event, Dr. Harrington, is going to be taking place over a period of 3 days, and it's going to be down in Council District 9. But what exactly is this? Because it's an antibody test versus the swab test that tests for active virus.
Right. So first of all, let me just say to your audience that all of the information that's collected is confidential. It's not shared with any government agency other than the Department of Health, and that's required by law. And so that you can come and get tested and rest assured that that information is protected. Everybody that's there is certified for HIPAA, and they're all well trained and all know about confidentiality. So please don't not come because you're afraid that that information might get you in trouble. It won't. It's only going to help you. So the test that we're offering at this particular thing is a antibody test. And the reason the antibody test is important is because you're probably more familiar with what's called a swab test. Okay, the swab test is detecting genetic material from the virus, and it's only for people who have symptoms. Generally, that's the recommendation. That you only want to do that if you're symptomatic. The antibody test, on the other hand, is for people who do not have symptoms or who had symptoms in the past and want to know whether they actually had COVID. Now, what's important for your audience to know is that when you're infected with a virus, your body mounts an immune response to it. That means it's going to protect you from this virus. And those antibodies develop over a period of about 2 weeks after you're infected, and they persist sometimes for many months and sometimes for years. And so it allows us to do two things. Number one, we can tell you whether what you thought you had in the past was actually a COVID infection. Number two, it will tell you whether or not you've developed a level of immunity to the virus. And the reason that's important is because people who do have antibodies have less virus in their body than people who don't have antibodies. So they're less likely to infect somebody else. And there's a third benefit which is actually unrelated to the information we'd give to a patient, but there are people who are deathly ill in the hospital. And there is some evidence that taking serum donations from patients who have recovered from the virus who have antibodies can be used to treat those people. So you could potentially be a donor for somebody that's severely ill. So that's an added benefit. But that's the main difference between the swab test and the antibody test. The antibody test is a serum blood test. It requires a blood draw.
Okay. All right. So say, for example, you test positive with the antibody test. So that means whether you knew it or not, in a period of time, you have actually had the virus in your system. But I know that there is some debate as to whether you will then become ill again if you are subjected to the virus, and how long the antibodies last. So where are we in the world of trying to figure out all of that information? Because you mentioned that it could actually make you immune to the virus, but we're not really quite sure about that yet, are we?
Well, actually we are.
We are?
We are. I'm a little dogmatic about this, but let me just explain how your body works, okay? First of all, the human body is an amazing device, so to speak, and it doesn't like to waste energy. So if it's making antibodies, they're there to protect you. They will neutralize the virus. We know that for a fact. Okay. Now the question that you asked that's most important is, does it really provide a level of immunity? And the reason that the human body is so amazing is if you develop antibodies during the phase of the infection, and then say with time they drop off, you have some cells in your body called memory B cells. And if you encounter the virus again, within minutes, those memory B cells are churning out those antibodies again. So even if your levels are low or undetectable after you've had a positive, you're protected. And we know that from other viral infections as well. Now you asked, can you be reinfected? Okay, in the millions of people who have had documented infection, there are very few cases that potentially could be considered reinfection. Okay, and the reason for that is what I just outlined. Once you've developed antibodies or an immune response, you're very unlikely to be reinfected. Now there are people, and the question that the healthcare community was trying to figure out is, why do some people get so sick and other people are fine?
Right.
Because the majority of people who get this virus have no symptoms.
Right.
That's just the way it is. And it turns out that there was a paper published last week that identified a genetic abnormality in most of those people who have gotten really severely ill. And it involves one component of the way your body fights a viral infection. It's called interferon. And so the bottom line is there is a reason why those people got deathly ill and other people don't. And it all revolves around the health of your immune system and whether you have some of these abnormalities in your genes. Okay?
Thus the whole underlying
Right.
issues that people have to be very cautious of. Councilmember, how did GuardaHeart find you, and how did you find GuardaHeart? How did this partnership come into being?
Well, one of my very trusted and able staff members learned of the GuardaHeart program in another community and said that that's something we should be doing in South LA. GuardaHeart certainly has a reputation of providing superior quality services, and this was an opportunity to join forces. And so we were happy to partner with them. As I mentioned before, we've done an extensive amount of testing in the community already. Some 100,000 individuals have been tested, and while 17,000 were tested positive, over the several months, we've seen that number come down dramatically. Unfortunately, we've experienced almost 300 deaths in our community associated with COVID-19. Mm-hmm. And so we wanted to make sure we're doing all we could to inform and advise and protect our neighbors and our citizens to the extent possible. And so being able to partner with this organization was an excellent chance to do just that.
Well, Dr. Harrington mentioned that obviously all of this information is confidential and will not, cause any kind of concerns to those that get tested. But is there a cost to this?
There's no cost. We want to make this available to individuals at no charge. It's very, very important and very critical. And it's consistent with a variety of other programs that we've been doing in the district to assist neighbors. You may recall that because of this pandemic, we've implemented a moratorium on evictions.
Right.
We're providing eviction assistance, in fact, to those property owners. We're providing free meals to our seniors who are unable to get out. We're providing financial assistance to businesses, nonprofits, and micro businesses who need assistance. So we're doing a variety of things to assist our residents and neighbors through this pandemic. Testing is certainly an important part of that. And just as there's been no charge for the COVID-19 testing, there'll be no charge for this antibody testing as well.
Along those lines, I have so many questions, but let's just start with a very straightforward one. Who should get an antibody test and who should not get an antibody test?
That's a very good question. So the people that should get the antibody test are people who do not have active symptoms at the time that they're coming in for it. So no headaches, no diarrhea, no fever, no muscle aches or pains, no cough, no sore throat, none of that. If they've had it within 2 weeks, say if they've had it longer than 2 weeks ago, then they can get the antibody test. But if they're in that symptomatic group, they really need a swab test. The swab test is designed to find out if you're infective or if you're infected before the antibodies potentially develop. So that's the main difference for people who should get it.
The prominent amount of people that have had COVID-19 have been asymptomatic.
Yes, that's correct.
So if you've had absolutely no interaction with anyone who has had COVID-19 and you've had absolutely no symptoms of COVID-19, it's quite possible that you have in fact had the virus and have not known about it. So that's a good person to show up at your test.
Absolutely. So, you know, even though you practice social distancing, you wear a mask, people forget. You go to the grocery store, you're handling fruit. You don't know who handled that fruit before you, you know. And you could have picked up the virus and not known it. Now, what I've been counseling people about, because this has not been addressed very actively, is you notice that a lot of healthcare agencies are testing sewage to identify areas where there's an outbreak. And the reason for that is because the virus comes out in urine and stool. And what we noticed is that family clusters are getting sick, and it appears that toilets can spring droplets up to 20 feet away. And so we're cautioning people that that is actually a source of infection that one must be careful of, especially public toilets where there's no top. And you should always wear a mask and wash your hands after you leave the bathroom, and try and stay out of the direct line of fire from the toilets. But it's not talked about much, and I'm trying to get that message out to people. Beware of your toilets.
I was going to say, I don't want to be lighthearted or flip about this, but one more thing to be afraid of is just, but you know, at least if you know, I mean, as we started this whole thing, you know, knowledge gives you a little bit, you know, another tool in your tool belt to protect yourself, because this unfortunate virus is not abating as fast as we would like it to.
Right, yeah.
And as has been pointed out, you know, black and brown communities are suffering disproportionately because of that. And there are a number of reasons for that, of course. You know, we're frontline workers who have been exposed
Big time.
to the virus. Frequently, you know, we're living in situations with close proximity with our family members, sometimes multi-generational. That has been an impact. Disparities, overall disparities in health, healthcare services. So we've got to be especially careful, especially critical, and thank you, Doctor, especially aware of all of the ways that infections can occur, and they can be prevented.
Right. And you know, just for the audience, the GuardaHeart Foundation is a 501c3. Everybody is a volunteer. There are no salaried employees in the company. 100% of donations go back to the community. And it's been around for over 10 years. We don't spend a lot of money on advertising or anything like that, but their mission is learn, detect, prevent. And so their whole goal is to get into communities and help them learn about how to prevent disease. They provide testing to determine whether you've been exposed, and then they talk about how to move on with your life after something like that happens. And they're a great group of people, and I'm really proud to support them.
So obviously, GuardaHeart is really focused on cardiac health. So what's the affinity between, you know, cardiac health and COVID-19? They obviously interrelate somehow.
Big time. That is an extremely important question, and I'm really glad you asked it, because people don't always ask it. It turns out that the COVID-19 virus, in order to infect you, it has to bind to a receptor on your cells called ACE2.
Okay.
Now, ACE2 is involved in blood pressure modulation, But what's interesting is that the most dense cluster of ACE2 receptors is in the lining of your arteries, okay? And so that includes the coronary arteries, the pulmonary arteries, the kidney arteries. All the arteries are susceptible to this. And if you think about that, that explains a lot of the symptoms, because this virus attacks virtually everything. But we're seeing heart attacks and strokes in people less than 50. And it's due to the fact that once the lining of your arteries, which is called the endothelium, is damaged by the virus, it becomes sticky and you start getting blood clots. And so a lot of the treatments are now centered around preventing those blood clots and minimizing the inflammation.
Obviously, as we talked about, the information as time passes is getting far more involved and complex, as you just represented. What about the whole idea that since this is not a respiratory virus as originally thought, that it's a full body issue, as you just referenced?
Yeah.
What about the idea of long-term damage? I mean, now there's this new buzz phrase, the long hauler, people that are suffering from effects of COVID-19 that at first were dismissed, thinking they were just imagining it or not necessarily related to the virus, are now being determined as being part of the virus. What's the current information in that regard?
So long haulers typically have a comorbidity like obesity, diabetes, cardiac disease, congestive heart failure, kidney disease. But they do seem, however, many of them do recover with time. They just take longer.
What are some of the concerns you're hearing from your constituents in District 9? Obviously, beyond the virus, I mean, I would imagine that there's a lot of things that are worrying people that would probably affect even protecting themselves from the virus.
As I mentioned before, the health care disparities that impact our communities are always at play, especially during times like this. And so, not getting a proper diet, not getting sleep, not having a job, not having a good job, not having the kind of health care that frequently can help identify these problems up front. People are concerned about that. They're concerned about not being able to work. They're concerned about having to choose between, do I go to work or do I stay home? Am I safe or am I at risk? And so all of these factors really play into causing a great deal of uncertainty, and especially when we're getting mixed messages at the national level. Wear a mask, don't wear a mask. We're going to have a vaccine by election day, and all these other hocus pocus things that are coming out, understandably are causing people to wonder and to be concerned. That's why we're doing all we can at the local level to make sure that people are certainly following the protocols of washing your hands, wearing a mask, social distancing, but also being tested and learning of what the situation is and learning how you can help.
So along those lines, the results of these tests, you mentioned that obviously if in fact you have been, if you test positive for the antibodies, you can be a plasma donor, but beyond that, what tool does that provide both, Councilman Price to be able to share, to help elevate his community? What does that do to the person? What information does that provide the person who maybe tests positive or negative, and what does that tell healthcare providers such as yourself?
Right, and that's a really important question, maybe the most important question we address here, because it's intended to encourage all of you to come and get tested. So what the antibody test provides to an individual is, number one, you may have had some sort of cold back a few months back and thought maybe it was COVID, and if you're negative, it probably wasn't COVID. And that's good to know, because that means you're still susceptible, and you should really maintain vigilance and wear masks and wash your hands and social distance and all of those things. If you are positive, you probably had it. Lucky for you, if you had minimal symptoms or didn't know it, you're one of the lucky people that is essentially developed an immunity to it, and you're not likely to infect other people, and you have some level of protection. We know that for a fact. What it does for our public health is that the swab test was predominantly testing people with symptoms. And it turns out that people with symptoms are a smaller segment of the people who actually got infected. And so what this does is it gives us a better idea of what the true prevalence of the disease is in the community. In July and August, we had a lot of what we call the millennials out there doing parties and things during summer break. And very few of them actually got sick, but they spread the infection through all of their friends and themselves, and they brought it home and transmitted it to older people. So it's really important that you know what your status is, and the public health authorities can then get a better idea of what the prevalence of disease is in that community, and they can intervene. They can do public education, they can improve the access to health care and testing. They can look at nutritional interventions, they can look at vitamin supplements, things like that would be helpful. And so I think in order for our, I mean, look, what you said is absolutely true. Every expert at the national level was wrong. The models were wrong, everything was wrong, but now we have really solid data and we're getting a better handle on what we need to do. And I think the main thing I would like to assure people out there is that, number one, that the community stepped forward and they're doing the right things. You've got people like this councilman who is really dedicated to the community. That's the sort of thing that we really need to have happen, and you're providing access to testing and to healthcare information and educating them. So, you know, one of the things the GuardaHeart group does is if people have questions after the test, they have medical science liaisons that will help them understand what it means for them, and we don't turn anybody away. Okay, so I'm not sure I answered your question.
You did, because it's important to find out, you know, who this helps, why this helps, and why someone should participate. And I think we should also clarify your background so that, you know, obviously I introduced you as Dr. Douglas Harrington here at the GuardaHeart, but you have a pretty substantive background in pathology and there was one other.
Preventive cardiology.
There you go.
Yeah.
So, you know, you're coming from a very learned perspective.
Right, well, so for those of you that don't know, pathologists study disease. They study how the disease develops. And because of that, we're more tuned into being a little bit skeptical of the first things that come out and waiting for real data to come in that you can look at and say, okay, now it starts to make sense. And I will tell you that from the standpoint of community health right now and what we're seeing, I'm significantly more optimistic about the state of people's health going forward than I was maybe 5 months ago, where I was very concerned. But I'm seeing a trend. Very few people are getting sick. The ICUs are not full anymore. There's 42,000 unused ventilators out there. What that means is doctors on the front line and people like all of us here are coming together, and we're educating people, and we're providing testing, and we're giving people the information they need to make good health decisions. It's as simple as that, you know.
Well, on a practical nature, the tests are available for 3 days in a row. And so where will people be able to go, and where exactly is the testing
Well,
taking
the testing
place?
will be done at our district office, 42nd and Central Avenue. The office is going to be open and available over the 3-day period. There's ample parking, and so individuals are welcome to come and join us. We certainly want to focus on CD9, but anyone that wants to take this test will be able to do so.
So log on to GuardaHeart and your office,
That's
and you
correct.
can schedule a test. And it's October 13th, 14th, and 15th. And what can people expect when they come to the test? You mentioned it's a blood test, so
Right, so
be aware.
let me tell you the process, because this is really important. Because we don't want people clustering there, we do it by appointment. There's an online scheduling, and you'll get the information for that. It'll be published, and we'll work through your office. And you make your appointment, and we typically have 4 to 6 phlebotomists. They're people that draw blood. So, but we stagger you in such a way that you're never having to be next to somebody. There'll be lines there, but there won't be long lines because they get them in and out very quickly. You'll come in, you'll be confirmed that you don't have a temperature and that you don't have symptoms. And again, I want to stress, we don't want symptomatic people there because we don't want you infecting other people. And then what happens is you'll be confirmed in the data set that we have. You'll be walked over to a line for the blood draw. You'll go in and you'll get your blood drawn, and you'll get information on how to get your results, and then you will leave. And the results will be available in 3 to 5 days after that. And what we typically do, and this is a source of confusion, but we're trying to help people, in order to comply with HIPAA, we have a confidential, it's called box.com, and what you'll get is in an email, you'll get a link to an account specifically for you. It's free. You have to make your own password, and you can retrieve your information from there. Okay.
Little blood, lot of blood.
It's little blood. It's 2 tubes of blood. It's actually 1 tube. We have a number of people opt for some other tests that if they come in and they may have heart disease or something like that. But it's really just a single tube, no more than 2, and they're not big tubes. It's 2 to 3 cc's of blood.
What will the test say? It gives a number, or it'll say negative, it'll say positive?
It'll say negative or positive.
Okay.
And the reason that's the case, and that's a good question, is the FDA has given emergency use authorization for these, and they want the sensitivity and specificity to be super high. And because of that, there is a cutoff. Anything above that's considered positive, anything below that's considered negative. I will tell you that in the below that section, there will be people who have low levels of antibodies, but in order to achieve 100% sensitivity and almost 100% specificity, they make it really tight. Okay, but it's fairly simple. It's yes or no, or negative or positive.
So the efficacy of this test is pretty substantive, because I know there have been some questions with the...
Yeah, so what happened initially was there were a series of kits that came in from overseas, China, various places. These kits were not vetted, and they were adopted very quickly because of an intent to try and get people tested. They were not very good. And that's when the FDA stepped in and started reviewing data and issuing emergency use authorizations. So the only tests that we use are tests that have emergency use authorization from the FDA. Mm-hmm. We won't use anything else.
So there's rather no chance of a false positive and a false negative?
Well,
there's always a tiny chance.
There is always a tiny chance, but the swab test actually has a significant level of false negatives during the first 5 to 8 days of infection. And that's because your shedding of virus is variable, and it's the skill of the person. Have you ever had a swab?
Yeah.
It's not a pleasant experience. Yeah. So people pull away. I do most of the swabs for the nursing homes because it's a challenge, and and it so the skill of the collection is very important. But the bottom line is, for the swab test, if there's a suspicion you're positive, the new recommendation from the CDC is that you do multiple tests frequently. Day 8 after symptoms is the optimum day.
Dr. Harrington, what are the age brackets of people that should and can take this test?
So we actually accept all ages down to the age of 1 year.
Wow.
1 year old. And the reason we're doing that is because these younger kids can infect the older people in the family, so it's very important to know where they are.
And is there an age limit on the other end of it?
Not at all.
Okay.
No,
all right.
no. Anybody above a year and older is fine.
Now, you mentioned that there are a lot of safety precautions in regards to people that are standing in line, but I know that there is also opportunities for people who are first responders. Is that correct?
Absolutely. The testing will be at our district office on 43rd and Central. There will be a priority line for first responders. However, individuals are encouraged to sign up in advance, and they may do so at GuardaHeart.org to register. Or they may call 866-299-8998. And again, it's going to be English and Spanish. No one is turned away. No one is turned away, and everyone is encouraged to come out.
Okay. Councilman Price, thank you for getting this all organized in District 9, and thank you, Dr. Harrington, for all of this remarkable information, albeit a little bit, it was frightening, but I think, well, I think the best thing, though, is to use an old phrase, forewarned is forearmed.
I agree.
Absolutely.
So the best
Yeah.
thing we can do is take all this that we are learning and utilize it so that this can pass and that we will all be happy and healthy and safe again.
Absolutely.
All right. Well, thank you both. I really appreciate your time.
Thank you.
Thank you.
And thank you, and make sure you sign up for the test.